Is your liver silently dying? According to the American Liver Foundation, 1 in 4 adults in the U.S. have some form of liver disease, and the worst part is that most don't even know it. From diet to medications, modern life is putting our liver at risk in ways we don't even realize. In fact, studies from top institutions like Harvard Medical School have found that liver damage can happen quietly, often without obvious symptoms. But if you know what to look for, you could catch it early and take control. In this video, we'll break down 6 critical signs that could indicate your liver is in danger. And these are signs you can't afford to ignore. One of the most overlooked signs of liver damage is pale stool. Normally, bile, produced by the liver, gives your stool its typical brown color. However, when the liver is damaged, it may struggle to produce bile properly. This leads to a pale or clay-colored stool, a common warning sign of liver dysfunction. According to research from the Mayo Clinic, when bile flow is restricted or reduced due to liver issues like fatty liver disease or cirrhosis, this is one of the first visible signs. The liver may also fail to properly metabolize fats, which can result in floating stools, which are a clear indicator that fat isn't being processed as it should. In fact, studies from the American Liver Foundation emphasize that this change in stool color can be an early indicator of liver problems long before other symptoms, like jaundice or swelling, appear. If you notice persistent changes in your stool color, this could be a crucial early warning to get a liver checkup. Don't wait for the symptoms to worsen. The earlier you act, the better the chances of managing or even reversing liver damage. Another surprising sign of liver damage can appear right on your face: yellowish bumps around the eyelids, known as xanthelasma. These yellowish deposits are actually cholesterol buildups, and they're a clear sign that your liver is struggling to process cholesterol properly. In a healthy liver, cholesterol is broken down and processed efficiently, but when the liver is compromised, it can't handle this task, causing excess cholesterol to accumulate in different parts of your body, including around the eyes. Studies from Johns Hopkins University show a strong link between liver dysfunction and xanthelasma, especially in conditions like fatty liver disease and cirrhosis. If you notice these yellowish bumps, it could be your body's way of signaling that your liver needs attention. Don't ignore these signs and consult a healthcare professional if you spot them. Have you noticed that your urine looks darker than usual? It could be a sign that your liver is struggling. When the liver isn't working properly, it can't filter out bilirubin, a yellow pigment that's produced when your body breaks down red blood cells. As a result, this bilirubin builds up in your bloodstream and can cause your urine to appear dark, often a deep amber or even brownish color. According to research from the Mayo Clinic, dark urine is a critical warning sign of liver damage, especially in cases of hepatitis, cirrhosis, or liver cancer. If you notice this change in urine color, don't wait. Early intervention is key in preventing further damage. Speak to a doctor for a thorough examination. One of the most visible signs of liver damage is jaundice, a yellowing of the skin and eyes. This happens when the liver is unable to properly process bilirubin, a byproduct of red blood cell breakdown. In a healthy liver, bilirubin is filtered out and eliminated from the body, but when the liver is compromised, such as in cirrhosis or hepatitis, the bilirubin builds up in the bloodstream, causing that familiar yellowish tint. Research from Harvard Medical School highlights that jaundice is often one of the first signs of severe liver dysfunction. If you notice a yellowing in your skin or the whites of your eyes, it's essential to seek medical attention immediately. This visible symptom could be an indication that your liver is struggling to perform its crucial functions, and timely intervention can prevent further damage. Swollen feet and ankles might seem like a harmless inconvenience, but they could be a sign of serious liver problems. This condition, called peripheral edema, occurs when the liver fails to produce enough albumin, a protein that helps regulate the balance of fluids in your body. Without enough albumin, fluid accumulates in your extremities, causing swelling, particularly in the feet and ankles. Studies from the Cleveland Clinic show that fluid retention is a common symptom in people with liver failure. If you've noticed your feet swelling, especially if it's paired with other symptoms like jaundice or dark urine, it's time to consult with a healthcare professional. Don't wait for the condition to worsen. The sooner you act, the better the chance of preventing further damage to your liver. An often overlooked sign of liver damage is itchy skin, which occurs due to a buildup of bile acids under the skin. When the liver isn't functioning properly, it can't filter bile effectively, leading to an accumulation of these acids in the bloodstream. This can result in intense itching, particularly on the hands and feet. Studies from Johns Hopkins University show that pruritus, the medical term for itching, is a common symptom in individuals with liver disease, particularly those with conditions like primary biliary cirrhosis. If you're experiencing persistent, unexplained itching, it could be your liver signaling that it needs attention. Don't ignore this discomfort. It's a clear warning that your liver might be struggling to perform its essential tasks. Now that we've covered the warning signs, it's time to discuss how you can take charge of your liver health. Reversing liver damage is possible, especially in the early stages. Key lifestyle changes can significantly improve liver function. Intermittent fasting, for example, has been shown in studies from Harvard Medical School to help reduce liver fat and improve overall liver health. Additionally, diet changes such as eliminating processed sugars and incorporating liver-friendly foods like leafy greens, turmeric, and milk thistle can support detoxification. Supplements like bile salts and antioxidants have also been proven to aid liver repair. If you want to give your liver the best chance for recovery, it's essential to implement these changes as part of a balanced routine. Speak to a healthcare professional to determine the best approach for your individual needs, and start healing your liver today. Now that you know the 6 surprising signs your liver could be in trouble, don't wait to take action. Regular liver checkups are crucial for early detection, and the sooner you catch any issues, the better the outcome. But don't stop here. In our next video, we'll dive into natural liver cleansing foods that can support healing and detoxification. Make sure to subscribe, like, and hit the bell so you don't miss it.